The public health management during the third wave of COVID-19 pandemic has involved many public departments. Therefore, many software and system has been generated and applied for the circumstances. The 4 existing management systems that have been initiated are CoLab, which is a system for reporting the contracted cases. CoNovo is a system for conducting disease investigation. CoWard is a bed management system. And lastly, CoAmbulance, which is monitoring the system for the patient transfer services. The key challenge of these systems is the similarity of their functions and the various input from different agencies. This has caused the redundancy of the data, which can hardly be shared and integrated between systems and among public agencies. The Ministry of Digital Economy and Society, or MDES, established the COVID data linkage, a CoLink system, in order to facilitate data management. The system will create a linkage of data by integrate all the existing systems to enhance the capacity and effectiveness of the public health management during the pandemic. The CoLink will become the main portal for public health management. It also allows the input of information from the private sectors, and thus it is essential to provide the application to the private sector. However, it needs to receive permission and approval from the authority. Under the CoLink system, there are 3 main components, including positive results of COVID-19 testing, bed management system, and lastly, the registration and disease investigation systems. The current task is to develop vaccine distribution managing system by integrating information from the existing registration systems to reduce the redundancy for vaccine distribution. CoLink is developed primarily based on the concept of data-driven and does not open for the public. Only some organizations have access to the system. However, a private sector like ThaiCare is also consulting with the Government Big Data Institute and the Ministry of Public Health to seek the possibility to link all the data to CoLink. The Government Big Data Institute, or GBDI, is now discussing with the Ministry of Public Health to solve current pain point of vaccine distribution, which is that there are many registration channels. Thus, there is the redundancy of information. The solution is to create a central data system. Except for Mor Prom and Thai Ruom Chai, each hospital will receive the Excel template, which they can export data from their system into an Excel file and share this information with the Ministry of Public Health. The system will use AI to consolidate information and clear the redundant information. However, this still limits to Thai people. In order to facilitate the vaccine distribution from migrant workers, some organizations set up their own 13 digits without consulting with the Ministry of Interior. Some numbers were overlapping with the Thai ID numbers. Now, the GBDI is working on the clearing data system, as well as looking at the possibility of using biometric methods. Apart from what has been mentioned, GBDI is also working on the development system to track and facilitate the mobility of vaccinated people. In addition, GBDI is working on the co-home isolation, which is the system to monitor home isolation. Ultimately, data-driven is important for the management during the pandemic. It is essential to consolidate all data and use it for policy making.